Hi, my name is kelejatu and I'll be presenting about cystic fibrosis. My mentor is Dr. Brennan and Ms. McMahon. We worked at Bronx Community College in Manchester Hall. This is my outline. What is cystic fibrosis? Cystic fibrosis is an inherited disorder that is passed down through families. A mutation that occurs in the offspring's gene causes thick mucus to develop in the digestive tract and the lung. It also develops in the liver, gallbladder, intestines, and reproductive organs. When this happens, it causes problems to the body. The gene symbol for cystic fibrosis is CFTR, which stands for cystic fibrosis transmembrane conductance regulator. Cystic fibrosis and body organs. With cystic fibrosis, the lung gets clogged up by thick mucus and it blocks the breathing passageway area where air can't get through, and this makes it very hard for it to breathe, for the person to breathe. The pancreas is part of the digestive system, and there is not enough absorption of nutrition, in other words, malnutrition, inside the pancreas. It also causes secretion from the pancreas of enzymes for digestion and insulin to become thick, causing pancreatic ducts to be clogged. When the thick secretion clog up the bile ducts of the liver and gallbladder, and it stops them from functioning correctly. When this liver is permanently damaged and the gallbladder ducts become clogged and has to be removed. The intestines are sometimes the first organs to get affected by cystic fibrosis. Thick secretion formed in the intestines in about 20% of all newborns, causing a life-threatening blockage called meconium ileus. The reproductive organs of men and women are affected differently with cystic fibrosis. For men, they are almost always infertile due to secretion in the sperm canal, which is caused by a blockage that stops sperm from getting through. Women are frequently able to become pregnant, but there might be reduced fertility caused of thick mucus in the cervix that blocks the entry of sperm. A person with cystic fibrosis may experience symptoms like excessive dehydration, salt and sweat, thick and sticky mucus secretion in the lungs, changes in the color and amount of things coughed up from the lung because of the thick mucus secretion in the lungs, wheezing, poor weight gain and growth, and foul-smelling greasy stool. Inheritance. If both parents have one gene that codes for cystic fibrosis, it is a recessive disease. There is a 1 in 4 chance that a child can be normal and have no gene that codes for the disease. There is a 2 in 4 chance that the child has one gene that codes for cystic fibrosis but is unaffected and she or he does not get the disease. There is a 1 in 4 chance that the child inherits both genes, each from mom and dad, that code for the disease and is diagnosed with cystic fibrosis. This is a picture of the inheritance. The purple gene is the recessive gene, and that's the gene, the CFTR gene. And the blue one is the dominant one, which is the normal gene. CFTR is associated with chromosome 7. The long gene of this disease is found on the long arm of the human chromosome 7q31.2. This mutation occurs from a deletion in 3 base pairs in the CFTR nucleotide sequence, which are CTT. The most common cause of cystic fibrosis is the delta F508 deletion, which is also known as the phenylalanine 508 deletion. This is the CFTR. This is a a regular nucleotide sequence, and in the CFTR sequence, the CTT is deleted, and the delta, which is the delta 508 F508 deletion, and this is how it looks afterwards. Cystic fibrosis can be diagnosed by doing a blood test. This helps find out whether the person has the CF gene. Also, a sweat test is used to indicate cystic fibrosis. If there is a high amount of salt level in the sweat, then the person has cystic fibrosis. There is no cure for cystic fibrosis, but if the symptoms are treated correctly, then it can be controlled. The first treatment to fight lung infections is antibiotics. Patients with cystic fibrosis are required to go to the doctor daily to get therapy, physically and inhaling, keeping the lung free of congestion. CPT stands for chest physical therapy, and it involves pounding the back of the chest, as you see in the picture, constantly making it easy for patients to cough out and remove the mucus from the lung. Life expectancy. People with cystic fibrosis are expected to live beyond their 40s because of treatment. Over 90% of infants live after their first birthday. This is my references. I would like to acknowledge Dr. Sack, Dr. Brennan, Ms. McMahon, ACS staff, ACS members, and Bronx Community College. Thank you.